Hey, 7th graders, on to day 4 of your engineering internship for malaria. Today's assignment is called Your Best Anti-Malaria Med Treatment. So today's the last day you guys are going to work individually before you get with your group and start to figure out how you're going to pitch your medical treatment to the class. So your learning targets today, I can apply my best knowledge of my isolated variables to design the most effective anti-malarial treatment. It doesn't necessarily have to be 7 days, so I'm going to go ahead and delete that. Okay. So moving on, you guys have your bell ringer. You guys can take a second, pause and complete your bell ringer. What you guys are going to be looking at is just kind of a review of what we've done so far. So what is the engineering problem you are trying to solve? Your first criterion was to minimize drug resistance, so why is that so important? Okay. Describe the second criterion, minimize patient side effects, and why is it important? And then finally, keep costs low. Why is that important? Okay, and then based on your research so far, which criterion do you think is most important for a successful malaria treatment? And based on your research, describe a strategy you will use when designing a malaria treatment. So that's going to be what your guys kind of are going into today as your first plan. Okay, so again, take a second, pause this video, complete your bell ringer, and come on back when you're ready. All right, so you guys are going to design at least 5 treatments for malaria. Remember, your 3 criteria are to minimize drug resistance, minimize patient side effects, and then keep the cost low. You also have one constraint, which is to make sure you do not see an increase in the overall parasite population. So if you have any of your 5 designs that actually have an increase in that population, it's one of the little boxes you guys check, then you have to redo that design. That doesn't count as one of your 5, okay? That one doesn't meet the constraint, so therefore it does not count as one of your 5. Okay, I'll go ahead and show you guys what you're going to look at for each of your 5 designs, and then I'll show you guys some extras. If you guys want to do more than 5 designs, you're more than welcome to. Okay, so here's your link into Malaria Med. Looks like this if you recall. Okay, you guys for this one are going to design anywhere from a 1-day treatment to a 7-day treatment. You guys can choose if you want it to be the full 7 days, 4 days, 2 days, 1 day, whatever. It's all up to you. You guys can also choose which drug you're using on each day. You guys only get to take 1 pill a day. Okay, and then also what size that drug is. So you guys would use an S to represent a small pill or a small dose, L is a large dose, and then X means that you're not using a drug on that day. I only wanted 4 days, so in that case I would X out 5, 6, and 7. Okay, and then you guys would say either drug A, B, or C. So if I wanted to put drug A on the first day, I'd type an A in there. Okay, and then I would say I wanted a small, so I would put a small pill in there. Okay, so you guys are going to be using those boxes to kind of highlight what you guys are doing for your different drug treatments. Okay, and then you guys will test them, and you guys will get your percentage of resistance for A, B, and C. You guys will use your draw tool to mark whether you had an increase, a decrease, or a large increase, or no change. Remember, your goal here is to get a decrease. Okay, overall, or even no change would be better, but if you guys have an increase or large increase, you guys may not use that one anymore, so you got to redo this one. And then what's your total cost for 1,000 treatments, and then patient side effects. Okay, you're going to save this rank part to come back to until the very end, so leave that box blank for now. Okay, after you finish design 1, you're going to answer these questions. Overall, how do you feel this malaria treatment performed? If the resistance numbers were high, what might you do to try to reduce them? If you guys got what you think are great resistance numbers, then say, I'm actually really happy, I want to keep them the same. If the patient side effects were high, like they had moderate to severe side effects, what might you guys try to do to reduce them? If you guys had no side effects or very mild side effects, you guys can just write that in there. And then if the cost was high, what might you try to do to reduce it? At this point, you guys should kind of have an idea or a baseline of what's high and what's not high. Or what's, good resistance numbers, good side effects, based on all the individual data that you guys did, isolating variables in day 3. Okay, so use those as kind of your reference points. Okay, and then you guys will move on. You'll do the exact same things for a different design. Okay, design 3, design 4, and design 5. Okay, from there, if you guys would like to do more designs, I listed up to 8 designs in here, but your requirement is 5. Okay, if you guys wanted to do more than 8, you're more than welcome to right click and duplicate some slides and renumber them as slides 9 and 10 or however many extras you want. Okay, once you guys are all done with your 5 designs at a minimum, 8 if you guys do more or whatever the case is, 6, 7, 10, Okay, you guys will go back and we're gonna look at those ranking boxes underneath your data tables. So once you are done with all 5 or up to 8 of your designs, go back and complete the ranking tables at the bottom of each data table. One will represent the best of, so if you guys are doing like 5 designs, you're gonna go from a scale of 1 to 5. Okay, 1 will represent the best and 8 will be the worst. So if you're looking at cost, you're gonna look at your cheapest one and you're gonna go in and say, all right, maybe design 4 was my cheapest. So under total cost, you guys can just use a draw tool too if you'd like. You're gonna say, all right, this was number 1, okay? And then, oh, you know, this was my second most cheapest, I guess my second cheapest. I'm gonna do that as a 2, so on and so forth until you guys have all of these boxes filled in. Okay, so you're gonna do the same thing for resistance of A, B, and C, total population, whether you guys saw an increase, decrease, those kinds of things, and then side effects. Okay, you guys are gonna see a tie because if you look at like increase, decrease, we really are only looking at decrease and no change, so there's really only 2 options there. So it's really hard to rank those 1, 2, 3, 4, 5 when there's only 2 options of data you guys might see. Okay, so if you guys are looking at that, if I have 3 of my designs have a decrease and 2 of them have no change, okay, then I can rank the ones that have a decrease all number 1. Okay, they're all equally tied at number 1. And then the ones that have no change, I could rank both as number 2. Okay, however you guys choose to do that. And then finally, with the side effects, you guys again would see some ties there. So I gave you guys a little example. So if you have a tie, for instance, 2 of your 5 designs all have mild effects, 1 has no effect, 1 has moderate effects, and the last has severe effects. You guys might rank them like this. Of course, out of 5, your no effects one would be your number 1. You had 2 had mild effects, so I would rank them both as number 2. So they take technically second and third place, but they're both tied for number 2. And that way the moderate effects is now number 4, severe effects is number 5. So this one's definitely ranked the worst out of those. Okay, so it might look something like that. Okay, and then you guys are gonna go ahead, look at your 5 designs or 8 or however many you guys chose to do, and you're gonna say, all right, this was my best design, it was design number 4, okay? So you guys can write that right there, design number 4. And then look at 3 pieces of evidence. So look at your percent drug resistance for A, B, and C. What were some other designs that came close? So design number and the percentages. Okay, what were your second places? Okay. Evidence number 2, what were your patient side effects? And then what was some of your comparable? Maybe it's not the same one. So comparable data, what was your number 2? Okay, maybe this one was your number 2, but you guys felt it was less important. Okay, evidence 3, total cost. This one should be pretty easy. What's your number 2 for that? Okay, and then finally, why is your design the best design? So give me a little 1-paragraph summary about why your design was the best design. That concludes day 4. Like I said, this is your last individual day before you move on to day number 5. I hope you guys are having a good day, and I'll talk to you soon.